everyone, and welcome back to the Empowered Cancer Patient Podcast. I have the distinguished pleasure of meeting with Perky. Perky are two wonderful nurses who work in nipple tattooing, and their names are Crystal and Courtney, and I am so thrilled to have them here with me today. Welcome, ladies.
Hi, thanks for having us.
My pleasure, my pleasure. Why don't you introduce yourselves?
Well, I'm Crystal.
And I'm Courtney.
And we're the nurse duo behind Perky.
Behind Perky. So the question that I have to ask right away is, what is Perky? What do you guys do?
Well, Perky is a one-of-its-kind studio located here in San Antonio, Texas, and we offer restorative tattooing to all affected by breast cancer. So specifically, that's that 3D nipple tattoo.
Wow. Now, I actually had the pleasure of seeing you guys doing some of those nipple tattoos when I went to the Breasties camp this summer.
Camp Breastie, yeah.
Yeah, Camp Breastie. That was really, really wonderful. And if I understand, you had clients or patients that were coming in that they had they reserved ahead of time, or they just came in on the spot?
We actually do giveaways with the Breasties community.
Wow.
So they apply. They know we're coming to camp. We've been, I think, 4 years now.
Mm-hmm.
And so people apply, and it's kind of a raffle, and we do as many as we can. But it's so great. It's really rewarding. We love going.
That's wonderful. How generous of you, and what a way to give back to the community. So let me ask you, how did you get involved in this? What made you think of doing nipple tattoos?
Yeah, well, we never thought we'd be here, that's for sure. But Courtney and I graduated nursing school together here in Texas, and then we went off our own ways. I went into a breast reconstructive clinic, and Courtney went to the hospital. But then Courtney ended up joining me at that breast reconstructive clinic, and we learned a lot about the breast cancer journey, including nipple tattooing. I have a strong family history of breast cancer, so that's also, I've personally been impacted by the disease. So we just really wanted to give back to the community in the best way we saw fit, and that was through nipple tattooing.
Wow, that's wonderful. Let's talk a little bit about the process, though. So you have a patient, and she ends up having a mastectomy for her breast cancer, and she may have, either an implant put in, or she may have some sort of a tram flap placed there. And then oftentimes in my experience, I remember a lot of patients would get a graft, a skin graft. I believe they take it either from the inner thigh or the vaginal wall, so that it's the right color, and then would make that little mound on the mastectomy reconstruction. So what you're doing is a different option, correct?
Yeah, we don't see a lot of the skin grafts anymore. They do kind of a CV flap nipple reconstruction more commonly now. They kind of fold skin on the breast mound and make the little projection. But more often than not, we're seeing women opt out of nipple reconstruction, whether a graft or nipple, the little surgically reconstructed bud, because they don't want to be at attention 24/7, having it like poking through a bra, or a lot of the time they'll flatten significantly, and so you have this extra scarring and this extra process that didn't really give you a whole lot. And a lot of people love the look of the 3D nipple best of all.
Right. Do you happen to have a sample there, something that we can take a look at?
Oh yes. You want to bring a skin in?
Sure. Let me go grab something.
Ooh, that'd be exciting. So tell me the process while she's getting the sample. Like how actually do you do this?
A lot of women are referred to us by their surgeon. So we always start with a consultation. We like to know your medical history, your surgical history, make sure you're medically ready and then emotionally ready, and you kind of know what's going to happen. But once they've cleared that process, they come in. We do a lot of measuring. So we want to make sure everything looks symmetric and that we're enhancing your breast reconstruction. We also try to cover scars. So if we're able to put it within, the skin island scar from a deep flap, or cover any part of the scar from implant reconstruction, we try to do that. And we go off we let the client take the wheel. So they help us pick size, placement, the shaping of it, and then they help us pick all of the color tones. So we spend a good portion of time mapping everything out before we actually start the tattooing process. Want to show our skins?
Great. Yeah, let me see it.
So here's a few, and here's a few, if you can see, but that's just an example. And these are on fake tattoo skins. So we just created these for
It's just
our
samples. And
clients
that's
to have an
amazing.
idea.
They look 3D. They really do.
Yeah.
We actually had more of these. We had a whole diverse skin line, but somebody at a breast cancer event walked away with 2 of them. Not sure what they're doing with them, but they have 2 lovely
Well, if I
skin
see them
tones.
pop up on social media anywhere, I'll let you know.
Maybe a coaster or something.
Coasters. God.
And then these are temporary nipple tattoos as well that we've created. So
Right.
someone who perhaps is not quite ready for permanent tattooing, maybe they're still healing or they're still on the fence if they want it or not. A temporary nipple tattoo is great. And these are, I mean, they're just so awesome. They look so good put on.
So how do
on
you
the
put those
skin.
on? They're just like glued or?
Just like you would any, temporary tattoo. You press with like water with like a warm compress
Right.
for 30 seconds, and then you peel off the backing paper, and then you're left with a tattoo that can last you about a week.
Wow. That's terrific. And then when they come in, after you do all the measurements, you decide the size and the placement and all, you actually use needles to do a true tattoo, correct?
Yes, if someone has decided that they want the actual permanent 3D nipple tattoos, that does involve sterile needles and about 2 hours of your time to get the permanent tattoos. And that's utilizing permanent ink, so those results should last you for years, and they look really great.
So can I ask you just how do you make them look 3D then? How do you do that with the needles, with creating the tattoos?
We learned a lot of different techniques, and over the years we've continued to improve our process. So I'd say we're always learning, but it's really about using contrasting colors, creating dimension with shadows and lining. Like Crystal mentioned, we use actual tattoo needles, and we use a couple of different variations to, give the areola a really soft, airy appearance, and then make a nice crisp line for some of the bud shadowing and things like that. So it's layering colors in a particular way to make sure we're giving the patient the result they want.
Right. So you're more than a nurse. You're more than a tattoo person. You're an artist. You are truly an artist. That's hard. I mean, when I love to color personally, so I always color, particularly when I'm flying. It just keeps me calm and occupied.
Oh, that's
so I have my color, and whenever I try to shadow something, I'm like, I don't know, is that how you shadow it? Which side gets the lighter side? Which side gets the darker side? And I'm trying to, invoke all the art that I learned in, elementary school. But that's really quite a process that you go through. So tell me a little bit about your temporary tattoos. I hear that you have this is a new product of yours, right?
Yeah, we realize that there's a lot of women who have to live a good amount of time without nipples after mastectomy, after going through the breast reconstructive process. And there's a lot of waiting period along the way from each stage to each stage. And mentally, that can have a huge mental shift on you when you don't see your nipple and areola there. Right. So instead of having them wait until they're medically cleared for nipple tattoos, they can start playing with the temporary tattoos and get that fulfillment that can bring. And also it helps them play with different sizes and colors to figure out what aesthetic they want when it comes time for the permanent.
Wow. And we've had a lot of women who they weren't sure if they wanted permanent tattooing, and having the temporary tattoo placed on that gave them that feeling of wholeness. And that's when they knew, okay, I'm ready. I do actually want permanent tattooing. So it can help with that as well.
Absolutely. So do you sell these? Can people buy them on the internet?
Yes, we sell them on our website, and we post a lot about them on our social media as well, but they're available in our shop.
Excellent. So if everybody can see in the upper corner, there is a QR code there that will take you to Perky's website. And so you can take a look at their products and all of their work and all of the wonderful things that they're doing there. How much do you charge for these temporary tattoos?
The price varies based on the sets, but one set is $650. And then if you're not local and cannot pick them up in office, then you'll pay some shipping and handling.
Wow, that's certainly very reasonable. So you could theoretically order a couple different sizes and types to try them. That's really cool.
Yeah, we launched We launched about 2 weeks ago, and we've had a lot of people ordering different styles and different sizes, which is cool. They're playing around. And we even have hearts. So some of our ladies, these are actually tattoos that we've done on women that we pulled off of them. So they're real tattoos, and we've done some hearts. So we made those into temporary tattoos as well. And we've had some orders for those, which is great.
That they put at the nipple or they put over on the side or something?
It's the areola is a heart shape, and then the nipple bud looks like a regular nipple bud.
Okay, that's creative.
You'll have to take a look on the website. They're fun.
I'm sure they sound fun. So do you have a program or something that helps cover some of this tattooing?
Yes. So we're in San Antonio, Texas, and there's a local breast cancer nonprofit here in New Braunfels, Texas. So very close. And they're called Pink Warrior Advocates. And through a partnership with them, we created the Perky Restoration Program, which started off just helping local women, but now it's national. So now women all over the country can apply to get their nipple tattooing or eyebrow restoration or scar camouflage services covered through this program through Pink Warrior Advocates. So it's amazing.
That's amazing. So they get funding from donations from different people or companies?
From donations. Thus far, probably one of the hugest ways we've funded is through galas that they throw annually and just auctioning.
That's wonderful. And what's the name of that organization again?
Pink Warrior Advocates.
Okay. Maybe we'll get their information as well and put those in the show
they're
notes.
amazing. You should.
Yeah, no, I'd like to reach out to them as well. Maybe they would be interested in my book. You know, I have a new book coming out, right?
A little bit. Tell me more about it.
Oh, yes. So it's called Calming the Cancer Chaos. It's an oncologist's guide to learning all about breast and gynecological cancers. It's sort of like an oncology 101 how-to type of a book. It really came out of 25 years of my experience treating women with cancer and all of the questions that they asked and all of the things that I had to explain to patients that they didn't initially understand. And it's really a way to level the playing field so that patients can become their own best advocates and can ask intelligent, educated questions and to really participate in their care. Studies have shown that patients that are participating in their care, that have good support systems set up, really do better overall, not just medically, but also psychologically. So I think it's a really important thing to try and get out there. And so I'm definitely very excited for my launch date, which is September 1st. We'll have to make sure to invite you guys to my virtual launch party.
Yes. No, that's amazing. And you're right on the target.
Yeah.
When women are part of their breast reconstructive options, all the way down to nipple tattooing and where to go and do they want surgical nipple reconstruction or not, having those open-ended conversations is everything when it comes to their ultimate satisfaction with their outcomes. A lot of times surgeons more so tell the patient, okay, this is the next step. This is what we're going to do, versus asking, do you want surgical nipple reconstruction or do you just want the tattooing? Do you want to have your tattooing here at the doctor's office, or would you like me to refer you out to Perky or, another place?
And meanwhile, the poor patient sitting there like deer in headlights, like, I don't know, what should I do? How do I understand? How do I make this decision?
Absolutely.
Right? Yeah.
But truthfully now with social media and like private Facebook groups and just the huge community that there is, because sadly so many people have been affected by breast cancer, I think seeing more and more of women or men like yourself that have endured the disease, have gone through it, getting wisdom from them has really helping the modern survivor make better decisions for themselves.
No, absolutely. I agree with you. So do patients fly to you from other parts of the country? Is it done in one process?
We do it in 2 steps. So it's always the first session, and then we like to do a touch up about 6 weeks later. We do have a lot of people who travel from out of state. And we've had a couple of people from Canada. So we're really like humbled and grateful for that. We want them to have an amazing experience, whether you're traveling or whether you're local. But for anyone traveling, we try to work with them. We want them to come back within a year of their first session. So sometimes they can't always get back to us right away, but
right.
And like the breast cancer
virtually too. Sorry, go ahead.
The breast cancer symposium is here every year in December. So sometimes that brings people our way too, because they're coming for that.
Yeah, no, that's a good plan. Yeah, so it would be wonderful if somehow we could find a foundation that would also help support the travel for people to get there, to get them done. But that's a big aspiration.
We're
Put it on
working
my
on it.
list.
We're trying.
Yeah.
That's
So-
our goal. We want travel covered and lodging covered. That would be
Wow.
ideal.
And also, not to give you business ideas that you probably have already thought of, but I'm sure you could create a course to teach other people how to do what you're doing because it's really special.
We're also working on that.
Yeah, good. I'm so excited. So what a wonderful service you're offering. And it has been such a pleasure talking to you ladies. Anything else you want to share with our audience?
If you're interested in nipple tattooing, if you're in need of nipple tattooing or you know someone, we do offer complimentary consultations virtually, in
Oh, wow.
person. So definitely on our website, helloperky.com, you could go to the schedule and book your consultation. We'd love to chat with you, even if it's just to answer some questions that you may have.
That is amazing. I am so honored to meet you ladies, and I'm really enamored by what you're doing. It's such a wonderful service and so much needed. Thank you so much for being here today. I appreciate you.
Thanks for having us.
Bye, everyone.